What is up, guys? I am back with another video, and today's video is gonna be all about my career. So if you guys don't know, I'm sure you see from the title that I am a dental hygienist, and this was a requested video from this user right here. What? Thank you so much for the awesome suggestion. I'd love to do a video on this, so here I am. So first off, I'm just going to talk about my look. So pretty much I did my makeup, my hair, and I'm wearing my uniform. So this is exactly how I look when I go to work. So I try to keep my makeup pretty fresh and simple. I kind of just do a light foundation, a little bit of blush here. I do groom my eyebrows a little bit, and then for my eyes I don't wear any eyeshadow. I just do mascara. And today for the video I do have a lash band on, but I usually just have my lash extensions, but I haven't been able to get a fill, so I just put on a lash band so you guys kind of have the feeling of what I go to work looking like. And then for my hair, for the most part, probably 99% of the time, I have my hair up like this in a little high ponytail. And then sometimes I'll put it in a bun just like this. Those are the two options, either high ponytail or a high bun. And then for my uniform, I always wear my raspberry, and then this is the Koi brand uniform that I have. So that's pretty much what I go to work. I don't have any like dangly earrings or anything like that. I usually just keep these in my second hole. And then for my hands, I keep my nails super short, and that's it. I don't do much to them, unfortunately. You can't have any acrylics or tips or anything like that, so that's a downfall to the job. So just really simple nails. Alright, so let's get into what dental hygiene is. When you go to the dental office, for the most part, you'll come in contact with three types of people who work there. So the first being a registered dental assistant, and there are different levels to each position, but for the most part, an assistant is someone who might take your x-rays. They also might take molds of your teeth, whether it's for dentures, partials, crowns, Invisalign, night guards, anything like that. They also will assist the doctor in whatever procedure they're doing. So they'll kind of be chairside next to you with the doctor while they're doing the procedure. And they also help in the sterilization of everything and just keeping the office running. For me, I'm a dental hygienist, and so what my job consists of, for the most part, like I said, there's different levels to each position, and each state is different. So some states hygienists can do more, and other states they can do less. So I pretty much can take x-rays as well. I am the one who scales and cleans your teeth, polishes your teeth. I also am the one who educates you on how to take care of your teeth and how to maintain and do a better job at keeping a good oral hygiene while you're at home. So I kind of educate you on dental hygiene or oral hygiene. So I'm the one who comes in and kind of takes a look, and if I see something, I'll let the doctor know, and then the doctor's the only one who can diagnose. So me being a hygienist, I can't diagnose and say, oh, you have a cavity here, or oh, you might have gingivitis. I can suggest or tell the doctor that you may have something, and then the doctor will come in and be the one to officially diagnose it. So I pretty much will come in and use the instruments that we have, and I'll scale off the tartar or the plaque that's on your teeth, and then I also will come in with the polish, the little gritty stuff that they do afterwards, and I'll polish your teeth. But the main purpose of a dental hygienist is to really educate the patient on oral hygiene, and then also for preventive measures to help prevent you from getting cavities or perio disease, and just really helping you maintain a good oral hygiene. And then obviously the last type of person you would run into in a dental office is the dentist. So the dentist can also scale the teeth, remove the plaque and the tartar from the teeth, but they mainly do like the bigger procedures like crowns, veneers, teeth extractions, diagnosing, things like that. Another thing is your office may not have dental hygienists. There are some dentists that prefer to just have an assistant and then they will do the oral hygiene aspect of the treatment. So some offices do not have dental hygienists. Okay, so now let's go ahead and dive more into dental hygiene. So in order to become a dental hygienist, you have to go through a 2-year program, and before that you have to do your prerequisites. And so the prereqs are pretty similar to a nursing position. So it deals with a lot of science classes. So you have to take anatomy, the chemistries, biology, microbiology, physio, and then once you finish all of that, then you can apply to a dental hygiene program. And the program is 2 years. And so once you're in the program, it's usually a smaller class. And for me personally, let's talk about my experience a little bit. I had to move to another city, so maybe like an hour away from my home, which isn't too far, so I was still able to drive back home when I needed to. But I was lucky enough to be able to stay with my brother and his girlfriend, so I didn't have to pay rent or anything like that. But it was definitely, it pulled me out of my element. I'm used to being at home. So that was a big change for me, even though it was just an hour away. I was living in a new house and just in a new city and starting a whole new part of my life. So the first semester was pretty scary, but at the same time I was excited to be in the program. Luckily I was selected for the program my first time applying, so I felt really lucky and I was just really excited for the new journey ahead. And then shortly after, the program just turned into the best 2 years of my life. I really did, you know, it's kind of cliche, but I really did make lifelong friendships out of the program. So the 2 years in the program really were amazing for me, and I'm sure if you guys are in a program right now or you're hoping to get into a program, you'll feel the same. It's really a life-changing experience, and I know you guys are gonna have so much fun. It's a lot of work, but obviously if you make it into the program, you're meant to be there and you're gonna do great. So throughout the program, you learn through lecture, you learn through hands-on experience, you learn by, you know, bringing in patients and having to clean their teeth. You also kind of do like internships, or we call them rotation, where the last year of the program we went out to actual dental offices and worked there for the day. So you do all of that throughout the program. So let's talk about the test. So the main test you have to take in order to become a dental hygienist, you have to take the board exam, and there's a written exam and then there's a clinical exam. So the written exam, and this is just my experience, the written exam was taken first, and then you have to take the clinical exam where you bring in a patient. They have to fit a lot of different requirements in order to pass as your patient, and then you basically have to clean one part of their mouth, and then if you pass all of the requirements, then you pass the clinical portion of the boards. And then after all of that, you have to take a law and ethics exam. So once you graduate from your program and once you take all of those tests and pass, then you are able to become a licensed dental hygienist. Okay, so now that you are a licensed dental hygienist, you're ready to go out and find a job. Every office is different. It just depends on what your employer is willing to give to you as the hygienist. So there are some offices that provide medical insurance and all of that, and then there's some offices that don't. And then for dental hygienists, it's really common for you to work at multiple offices. So you might work at one office for 3 days a week and then a totally different office for 1 day a week. It just depends. For me personally, I chose to only work 3 days, so I'm only working in one office 3 days, which is considered part-time. Right now 3 days is perfect for me, and if I did want to work more, I do have that opportunity. Okay, so let's go ahead and talk about pay. So every office is going to be different. Some offices might pay you hourly, some offices might pay you by the day, and then also they may pay you by the amount of patients you see. I went ahead and Googled what the average salary for a dental hygienist is, and it said it was $73,000 a year. Also, I want to share with you guys, when our program was coming to an end and we were getting ready to go out in the real world and go to different interviews, our instructors were telling us that you know, one of the main things obviously that you're going to talk about is how much you're going to be getting paid. So they shared with us that they wouldn't recommend we work for less than $40 an hour. And then they also shared that in our particular area, the average pay for a hygienist was around $55 an hour. So they kind of gave us that range to show us what we should be asking for when we go on these different interviews. So I kind of wanted to share that with you guys as well. Every state is going to be different. Okay, so lastly, I'm going to share with you what a day at work looks like for me. So I arrive at work 10 minutes early, and then I can kind of take a look at the schedule, and then I'll go ahead and just click on the medical history, on the clinical notes, and it's all I need is 10 minutes to get everything set up and just to make sure I'm prepared for the first patient especially. And then obviously throughout the day I can just click on all of that for each patient. It's really easy. I can just read over it and I'm good to go. Usually the assistants will have some of the rooms set up for my patients as well as the doctor's patients. And then I go ahead and just call in my first patient. So at my office, I have about an hour for every patient. And again, every office is different, so this may differ. Some offices will only give you 45 minutes to do a cleaning. Some offices might give you 30 minutes if it's a child. But for the most part, my office just blocks off 1 hour for every patient. So I'll go ahead and call in my patient. I'll ask them if there's any changes to their medical history. I'll ask them if there's any teeth that are bothering them. And then I'll take note of all of that. And then if they are due for x-rays, I'll go ahead and start off taking x-rays. And then we will go into cleaning. While we are doing the cleaning, I kind of talk to my patient. I ask them, you know, how often are you brushing? How often are you flossing? Do you have any concerns or questions about ways you can improve at home? If I see a certain area that might have a lot of buildup on it, I will let the patient know. Sometimes I'll even give them a mirror to show them. I pretty much just want to ask the patient questions, and whatever they have concerns about, I want to make sure I address them. So I just try to give them the best advice I can, and each patient is different. So I just, once I'm in their mouth, cleaning their mouth, I can kind of, you know, figure out what advice I can give them to help them improve at home. Once I'm done cleaning the patient's teeth, then it's time for the doctor to come in and take a look. They'll either look at the x-rays. If there are some updated x-rays, they'll just take a look inside their mouth. And then once that's over, then I will sit the patient up and I'll offer them if they want to rinse out with any Listerine or water. And then I'll go ahead and schedule their next appointment. So if the doctor didn't see anything, I'll go ahead and schedule them for the next 6 months cleaning. If the doctor needed to schedule a fill, I'll go ahead and schedule that. So it just depends on what that specific patient needs. And then I walk them out, give them a little goodie bag, and then it's on to the next patient. So my morning session has about 4 patients, and then I'll have an hour lunch break. And then usually for lunch, right at the beginning, I'll go ahead and take notes. So you have to take notes for every single patient. You want to maybe write down any findings that you found, anything the doctor diagnosed. You want to write down their oral hygiene, kind of, maybe how many times they brush, if they floss, what condition their gums are in. You also just want to write down any personal information that you learned about. Do they have kids? Are they married? What are their likes and interests and things like that. Or also you want to write down things that they might not like or things that they really do like during the cleaning. So some patients really want to hear the scraping, so I'll maybe jot that down. Some patients also really hate the scraping, so I'll write that down as well. There's also a water instrument that we use. Some patients do not like it at all, so I will make sure I write that down in the notes so that I don't use it the next time they come in. So notes are very, very important, and you have to do them for every single patient. So I kind of write down little notes on a post-it throughout every patient, and then like I said, at the beginning of my lunch break, I'll go ahead and do my notes for the first 4 patients, and then my afternoon session has 4 more patients, and then once that's done, at the end of the day, I'll finish up all my notes that I have to do, and then I'll also help the assistants clean up the chairs and just sterilize things and just wrap up the whole office, and then it is my time to go. So that's pretty much what a day in the life of a dental hygienist looks like. I think I covered a whole lot of stuff, but if you guys wanted to learn anything else or had more specific questions about anything I touched on today, please let me know in the comment section down below. And yeah, I am here to help if you have any questions. I'd love to, either write back down there for you, or I can do another video, so just let me know. I will see you guys next time. If you enjoyed the video, please give it a thumbs up and don't forget to subscribe, and as always, remember to stay bold, beautiful, and blessed.